We will be entering into a federal partnership exchange for the first year.
This is going to be a stimulus that not a lot of people are talking about.
I think you'll see in the vast majority of states, with very few exceptions, that the coverage package will look a lot like what's currently being marketed and sold in the small group business market today.
We'll probably have about 600,000 of those 1.2 million people in some form of a shared savings, capitation, risk-based arrangement.
As far as the exchanges go, we announced that we will be entering into a federal partnership exchange for the first year. We're leaving kind of a question open about what we'll be doing in years after that. But we submitted our blueprint application to Federal Health and Human Services in last month in November for the partnership exchange. That means that the federal government will be operating the exchange. They'll be administering the bulk of the functions, the enrollment, the eligibility, the premium assistance, those things. But the state we have indicated that we want to retain some functions, particularly around the plan management.
You are going to see many Republican governors, states led by Republicans, that are going to A, have an exchange, and B, join in the Medicaid program for the expansion, because as Crystal said, which we often forget about in things to watch, this is going to be a stimulus that not a lot of people are talking about. I mean, there are going to be, and you do hear a lot of complaints from providers, but I often write in my stories, you're talking 30 million paying customers.
On the essential health benefits benchmark selection, which is sort of determines what the minimum standard is going to be for health benefits on the private side, but that is also an area where Illinois has moved forward and made a decision along with 24 states and the District of Columbia. Of those 24 states, the vast majority, except for 6, have chosen their this largest small group plan, or one of the largest small group plans for small businesses in the state. So I think you'll see, and for the states that have not selected a plan, they're also going to end up with the largest small group plan in their state. So I think you'll see in the vast majority of states, with very few exceptions, that the coverage package will look a lot like what's currently being marketed and sold in the small group business market today.
We take care of, on an annual basis, about 1.2 million people, about 25% of the primary service areas that we're in. And we're going to be moving them as incrementally into some form of shared savings to the extent we can control it. So, for instance, last year we have 50,000 commercial members that we manage under a risk arrangement with a health plan partner, so that we're actually developing very important capabilities. We'll move our own employees into this type of narrow network. We're directly contracting. We're awarded a major contract, direct-to-employer contracting with a narrow network, no health plan intermediary, for Home Depot and Walmart in the Chicagoland area. We had our federal ACO application approved last night, so we'll be moving our Medicare beneficiaries into that. So over the span of about 4 years, including the movement of Medicaid into managed care, we'll probably have about 600,000 of those 1.2 million people in some form of a shared savings, capitation, risk-based arrangement. So we're building those capabilities right now, trying to do it in a way where we don't get so good at it that we can't survive losing the volume-based business.